Hi there, my name is Tom Willman, physical therapist from Apex Orthopedic Rehabilitation. We're right here in Wyckoff, New Jersey. Today, we're going to give you a little help with, if you've been doing McKenzie neck exercises, we're going to show you a few alternatives if you're not having success. If you want to get to the exercises right away, just check our description. It shows you exactly where to tune to so you can go right to the ones that we suggest as our alternative exercises. So really important is to know if these movements are good or bad for you. Okay, so we want to understand where the pain is when we start the exercise and if it moves. So I'm just going to go through like a case study, like an example of it. So if you're having, let's say, neck pain and you're having pain on one side and you're having into the shoulder blade, let's say it's like halfway in the upper arm area. Okay, so that's our starting point. So someone says, hey, I'm starting this exercise, I can feel it here, and it's all the way up to my neck and to my shoulder blade. Centralization means that as we're doing this exercise, let's say it's a retraction or a retraction extension, we're noticing that the movement is moving up, and now it's no longer, it's not down the arm anymore, it's really just in the shoulder blade or let's say the upper trap, this area right here. That's a good sign. That's called centralization, okay? If you're doing the movement and you're saying, okay, I started doing this movement, the pain was about mid-arm, as I do this movement, it's actually starting to go down to my elbow or down to my forearm, that's considered a poor direction. That's called peripheralization. It's a concept called centralization and peripheralization that guides us on whether this is a good or bad exercise. So when you're doing it on your own at home, you know what's considered a good direction. Occasionally there'll be no movement at all. You'll just say, Tom's not getting worse or better, it's just about the same, then you can continue to do the exercise, okay? Sometimes the pain doesn't move, okay? It stays, let's say, in this upper arm, but let's say it used to be an 8-level pain on that 0 to 10 scale, but now it's becoming a 5. That's telling us that's still considered a positive direction, okay? If the pain is still radiating down, but it's less intense, it's still kind of a sign that you're probably irritating because it's going further away from the origin of the problem. So just use that when you're doing any of these cervical exercises or neck exercises as a general guideline as far as whether it's good or bad, or sometimes you just have to modify the way you're doing it. You're just not doing the exercise correctly, or it's not the correct exercise for your particular neck problem. If you're in the area in northern Jersey, specifically right around the Wyckoff area, you can come in for a live appointment if you're really not having success with doing some of these exercises and you need a little bit more guidance. Two of the most common exercises we give out are called cervical retractions and cervical retractions with extension. Okay, and we typically do these in sitting, good posture. They're the most common ones. So we'll tell people to do those exercises, 10 times every 2 hours, sometimes like 5 times a day, as long as they're neutral or improving. Typically we see a change in about 3 to 5 days, okay? Most people, I find, with neck exercise, they enjoy to be in more of a seated position when we do these particular exercises. But some of the alternatives we're going to show you are not all done in a weight-bearing position, okay? But just keep that in mind. Okay, the first one we're going to show you is basically we're doing a cervical retraction extension, but we're going to get a little assistance with using a little pillowcase folded lengthwise, okay? So from the side view, now this is an alternative exercise, but this is actually a technique that I use for McKenzie exercise, but this one was originally done by Brian Mulligan. It's another therapist. So the way we're going to do it is, depending on the level that we're trying to get to, we're going to pull into retraction like this, and we're going to cup the very base of our skull right here, right when it comes right below the point where it becomes neck from the skull. So we're going to retract, and then we're going to roll our head back. But as we go back into extension, we're going to cup the back of our neck so we can kind of support it with this pillowcase. All the way back as far as we can. We can still do that little wiggle like that, and then back down. The idea is that the pillowcase is just unweighting the head a little bit, okay? And sometimes that's a little bit more comfortable, especially if you're having a really acute pain and it really is bothersome. So we're basically going to retract, come in, and then roll back up, and then back down. This is an alternative exercise, but a variation on a traditional McKenzie exercise, okay? So we'll start with that. Same idea as far as how often you're doing it. But that's the one variation. Some people do really well. They can go a little bit further, and then eventually they'll go without it, and they'll go back to doing the traditional one, and they'll find that it's a lot more comfortable, okay? So the next version is just a retraction in prone, lying on our stomach, okay? So we're gonna lie down, elbows like so, you're propped up. You wanna do a retraction going straight back, just like you're doing in sitting, okay? So you're doing a retraction and releasing. Okay, just like that. Okay. The second part to this is a retraction with extension. So you're going to come up, you may have to bring your elbows up a little bit. Take your fingers and you want to push them as if you're creating an arc. You're going up this way. So you're going up, and then you can add that little wiggle. Now I'm at the very end of my motion here, so you want to feel like you're getting to the very end. If you're not, scoot your elbows up further up so you can go as high as you can. This one you'll feel into your upper back a little bit more in addition to your neck, okay? So just go over it again. It's retraction, a little pressure, and then roll back, scoot your elbows up, and a little wiggle like that. Cervical retraction is the first part. Second part, cervical retraction with extension. You're going to feel it much more in the upper thoracic here, which is good if you've got some of the problems with mobility is in that area as well. So the next alternative is actually lying down. I'm going to put my head down here. I'm going to be on my back. This one is when people are really feeling like they're really tender, they're very sensitive. We have them lie down on their back with their head supported by the pillow. So you're doing the cervical retraction that we do in sitting, but now we're going to lie down. Doesn't matter your legs. I tend to find I'm more relaxed with my legs bent a little bit like so. And you essentially want to get a retraction like this. Hold maybe 3 to 5 seconds. Or if it's really sensitive, just do it for a second. But you do want to get to the point where you're getting to the very end. So pull in and then release like that. Okay? Like I said, it should never make it feel worse. Okay? Sometimes when you sit up, it changes a little bit after doing it, but you generally get a good sense of how it feels, and you're a little bit more of a supportive position, so it's more comfortable if you're really having acute pain. Next version, take the pillow out, and this one's a little harder to do. You're gonna scoot to the very end. If you have a massage table or a bench, it's a little bit better. You wanna have it so your arms go just at the very edge of the bench. You should go to your armpit here, okay? So you're gonna do the same exercise. You're gonna do a retraction, but you're going to support it with your hand. You can do it with both hands. Retract back, just like that. And if you feel comfortable, like, hey, this is progressing, I feel more comfortable, I'm getting better range of motion, my pain is centralizing, it's not peripheralizing, as we talked about earlier, is it good or bad pain, or good or bad movement. The next one you can do is you can do both hands, you can retract, and then roll your head back. The only problem is it tends to be is our arms limit how far we can do it, so we're basically supporting our head here. So we're going to retract and then roll back. Okay. If you need a little help pulling back up as you come back up, you can do that. But basically retraction, or you can do retraction and extension. Retraction and then extension. Little wiggle if you want. Feel comfortable, you can even just let it fall out like back like that. Let the weight of the head create the stretch. And then back up. So those are my alternatives. Try these out. Typically, if you're going to have some success, sometimes it's immediate. Like I said, it shouldn't make it feel worse. After 3 to 5 days of doing this about 10 times every 2 hours, it's about 5 sessions a day, you should see an improvement. If you're not, it may not be the right exercise for your neck, or you're not doing it right. Some of these techniques we're showing you, the patient's doing all the movements. Sometimes you need some hands-on stretching, and we do very similar movements with me as the therapist. We'll actually say, we'll have the patient do these exercises, and if they have trouble, we'll do some hands-on ones where we can exert a little bit more force and a little bit more specific to the area of your neck that you're having trouble. So, hope that helps you out. Try these alternatives, but remember, always listen to what you say, whether it's good or bad pain, and centralization and peripheralization, okay? If you like this, just subscribe to our channel. Please place a comment if you have any questions at all, and like it, okay, if you want to. If you're interested in seeing us at the clinic in Wyckoff, just go down below in the description. You can give us a call or text us or email us, and come on in and see us live, all right? I'll be the one to be working with you. Have a great day.